Ma'am.
In today's society, one of the most popular, controversial, and emotional debates is the decision of ending a terminally ill person's life. Unfortunately, terminal illness can happen to anybody, and it is possible that some of us may have or have already had to watch a loved one suffer through it. Personally, I've had a number of family members who I've had to watch struggle through a disease that completely took over their body and their spirit. According to authors Helen Starks, Denise Dudinsky, and Nicole White, physician aid in dying refers to a practice in which a physician provides a competent terminally ill patient with a prescription for a lethal dose of medication upon the patient's request, which the patient intends to use to end his or her own life. In my opinion, physician-assisted suicide should be a legal option for terminally ill patients because every person should have the right to control their own lives in one way or another. Today I'm going to share with you my 3 reasons behind this belief. The pain and suffering of the patient can be saved, the right to die should already be a fundamental right, and the patient will be able to die with dignity. One reason, and perhaps the most obvious, that physician-assisted suicide should no longer be prohibited is that the tremendous pain and suffering of the patient can be saved. Many have illnesses that will result in slow and agonizing deaths, and their days are usually already numbered. This can obviously take a toll on a person, not only physically but mentally and emotionally as well. According to Jolie Lee, a Pew Research Center poll found that 62% of adults believed that a person has a moral right to end their own life if they're suffering great pain and have no hope of improvement. A growing number of people are joining the side of the debate that supports one's decision to save his or herself from the unbearable dying process. Now, one of America's biggest goals has always been to make sure every individual knows that they are free and able to exercise their rights. Because of this, a second argument for physician-assisted suicide is the fact that the right to die should already be a fundamental right for every individual. Our country is supposed to be free, so why isn't it our right to make the decision to end our lives if there really isn't any other option for happiness and health? Although many critics argue against it, Oregon, California, Washington, and Vermont have passed the Death with Dignity Act, a law allowing these residents with a prognosis of 6 or fewer months to live to end their lives by taking medication. And as you can see on this map by the light pink colors, many other states are debating it, as stated by deathwithdignity.org. According to Janelle Alicia, a writer for NBC News, the SCAA found that even though the Death with Dignity law was rarely used, both patients and families frequently expressed gratitude after receiving the medication, regardless of whether it was ever filled or ingested. If both the patient and family agree that dying is the right and better thing to do, whose business is it to shut down their opportunity? A complete prohibition against physician-assisted suicide limits personal liberty, which is unfair at every aspect. Lastly, let's not forget about the whirlwind of emotions a terminally ill patient struggles through, knowing their disease may take over every unique part of them. The third and most emotional reason for making physician-assisted suicide legal is it will give the patient the opportunity to die with dignity rather than let their illness reduce them completely. A great example of this, according to NewYorkTimes.com, is the recent decision of 29-year-old Brittany Maynard to end her life after being diagnosed with stage 4 malignant brain cancer, or 41-year-old Ethan Remmel, who took a lethal dose of crushed prescription sedatives after being diagnosed with terminal colon cancer. These people exercised the death with dignity option to have control over their illness before it took away their ability to take care of themselves. In Jonelle Alicia's article, Doctor-Assisted Death, A Dad's Choice Sheds Light on a National Issue, Grace Wang, Ethan Remmel's partner, said, "One of the things that Ethan kept saying is he didn't want to deteriorate to the point where he couldn't interact with his kids." Also, according to the article, Is There a Right to Die from USNews.com, supporters of this legalization say it allows terminally ill patients to end their lives on their own terms, in their homes with their family, rather than at a hospital unconscious or in agony. Although patients who request the medication may not always decide to use it, it will give them relief to know that they have some control over their dying process. For years, doctors have not been allowed to assist patients in taking their own lives, However, recent laws in Oregon have started a legalization trend. Every person should have the right to take control over their own lives, especially if they have taken a turn for the worse with terminal illness. The reasons for the legalization of physician-assisted suicide are actually quite simple. The pain and suffering of the patient can be saved. The right to die should already be a fundamental right, and that patients will be able to pass away with their dignity. Hopefully, in years to come, every state and country will accept the Death with Dignity Act, bringing relief to all terminally ill patients all around the world.
Just